She lied. Good evening, everyone, and welcome to the first meeting of this year of the Community Service Committee of the Common Council of the great city of Norwalk. I am the new chair of this committee, Nicole Ayers, and we will call the meeting to order at 7:02. And I saw Councilperson Greg Burnett, Councilperson Barbara Smith. I
Of the
saw
great city of Norwalk. I am the new
Council.
chair of this committee, Nicole.
I'm hearing feedback. Is anybody else hearing feedback? Okay, maybe it's just me. Um, Councilperson Barbara Smith, Councilperson Doug Sutton, and Councilperson Heather Dunn is on the line. Did I omit anyone?
Melissa, did you get me, Melissa Murray?
Oh, thank you, there, Melissa. Councilperson
Hi.
Melissa, and as well, I thought I just saw Councilperson. Yes, I did. Councilperson Dewan Wiggins is also online. We will now open up for public comment. If there are any members of the public that wish to address this council, we ask that you would use the raise hand feature on your Zoom. You will be unmuted by our IT people. We ask that you give your name and your address and that you speak on topics that are presented on this evening's agenda. Mr. Daniels, are there any persons for public participation?
Yes, we will be promoting Diane Loricella.
Good evening, Ms. Loricella.
Good evening. Can you hear me?
I sure can.
Madam Chair. For the record, my name is Diane Loricella at 21 Little Fox Lane. And I'm here tonight to hear the reports from the Health Department, as well as listen to many of the good works done by this Community Services Committee and the staff. But tonight I wanted just to speak in my time to speak about item 51A. Tonight you're going to be voting on the application and acceptance of about $500,000 to be put towards efforts related to COVID. And while I urge you to do so, I ask that you consider the following caveat. Just for the record, since our pandemic in 2020, I have occasionally appeared before the Board of Health, as well as this body and its predecessor, I guess it was called whatever Community Services was before, where we talked with the Health Department. Anyway, I wanted to tonight for you to consider. I was not able to get my hands on the actual contract terms or the application terms and details about what we have to do. The State Health Department is stating what we must do and what we leave up to our own discretion. I want to make sure this year, after the last 4 years, I have been attempting to make suggestions and solutions to provide a more robust and creative outreach to remind people after the initial COVID and all of the misinformation back in the 2020 and 2021, but still remind people to this day how to reduce their chance of not only catching COVID, but also flu and RSV. And the means that one can do this is through creative use of posters. And I have suggested this for several years now to almost no avail. I will be contacting our health director and Mr. Daniels, because life is short. And I know a lot of people that have become ill just in the last month from COVID and the flu. So tonight, I just wanted you to suggest or ask or urge Mr. Weeks and Ms. Argandesi and the health director to, here are the following questions. I'd like to know if any of this money will go towards free COVID test boxes. We did have some, but not a lot. Will any of this money go towards distribution of free KN95 masks and N95 masks, which are the only masks that we should be wearing, not the surgical masks, in an effort to reduce our chance of getting the aerosol-based COVID? Will money be spent towards posters, both in English and Spanish, that could be posted at our major gathering points in town, as well as the supermarkets, City Hall, the library, and schools, that just remind people how to reduce their chance of getting the flu? And lastly, would they consider training and engaging a group of citizen ambassadors to go around different parks and the like to remind people in a friendly way and to give out said test boxes and face masks to people to remind them and educate them about how to reduce virus? I know that at my urging, there was a small postcard that was put together in English and Spanish titled "It's Cold and Flu Season. This fall, let's take steps to prevent the spread of all germs and viruses." I think that's a good start, but it didn't go far enough. And it did feature a picture of someone in a mask, but it looks like a surgical mask. And I think we're not optimizing our chances to educate the public. And I think the public relies on you all. And all.
Ms. Loricella, could you
Yeah.
please wrap up? You're over your 3 minutes, please.
Oh, sorry about that. Thank you very much. I truly respect all the work done, and I ask that you ask these questions, and I will follow up with the staff. Thank you. Good night.
Thank you. Are there any other public comments?
No, Madam Chair, there's no other individuals in the chat, and also we have not received any emails or correspondence to read into record.
Thank you, Chief Daniel. So at this time, we will close public participation at this time. Next, we will have the approval of the minutes from the meeting held on September 21st, 2023. Can I get a motion? Someone on the committee approve the minutes, please.
Madam Chair, maybe you didn't see my hand. Greg
can't
Burnett.
I'm sorry, y'all.
Okay.
You gotta
right.
say it because I can't see anybody. I don't know what's going on here.
I'll
Greg.
move minutes from the stated minutes.
Okay, is there a second? Someone say something. I can't see you.
I will. It's Heather.
Thank you, Heather. All in favor, denote by saying aye.
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 Aye, I got 4. Any abstentions?
This is Melissa abstaining.
Thank you.
And
Any-
Doug Sutton has his hand up too.
Can someone tell me why I can't see everybody on this thing? So I have 2.
Nicole,
Yes.
if you go to the very right of your screen, there's a box called View. There, you can actually, maybe you're on the wrong setting, which is maybe why you can't see everybody.
Top right.
Almost
How many
like
people can you see?
Whoever's speaking, that's all I can see, so I can't see.
Oh, yeah. You got to change your view.
Oh, I never had to do that before.
Go to gallery instead of speaker.
Okay, well, we're gonna do that, but let's finish. We have an open motion on the floor. So, any nays? Mr. Wiggins, what was your vote? I'm sorry, I did not capture it.
Abstaining.
Okay, so we have 1 abstention, 2 nays, and the rest carried. So the motion is carried. While I try to figure out my technical difficulties, I will turn the meeting over to Chief Daniels to bring his team to present to us at this time. Chief?
I'm the IT person too. I don't know if you're aware of that, so just bear with me. So good evening, everyone, and welcome just particularly to the new council members. So in speaking with Chair Ayers, we decided to, in my remarks, to give an overview of the Community Services Department by way of sharing who we are and what we are. So we'll do that at the beginning, and then we'll turn it over to Teresa. Sherelle Harris is not with us this evening. She's not feeling well, so she's getting well-deserved rest, but she'll certainly join us in terms of the community services. And then we'll ask Anna Vivian to share information on the Human Services Department. So we are known for having slide decks, so if you bear with me, I'm going to share my screen. Can everyone see that? Hands up. Great. So we are Norwalk Community Services Department. For those that recall, about 5 years ago now, and I serve as the inaugural Chief of Community Services for the great city of Norwalk. And so for those that recall, 5 years ago, the city engaged in a restructuring in how city departments were served based on efficiency. And so we combined the health department, many of the youth services, fair rent, and other departments in the library system into the community services department. What you have before us is the leadership team. Deanna is not with us tonight because she had other obligations. Anna Vivian, you'll hear from tonight. And then most of you may know Sherelle, and Sherelle couldn't be with us today. But this is the team of the Community Services Department. What is our vision? Our vision is very simple. Community Services envisions a community where all residents have access to knowledge and information about programs and resources and the ability to access them so they can reach their full potential in life. And I will make reference to this because you'll see that we're not talking about delivering services, because Norwalk, Connecticut is made up of 169 towns and cities, and all cities are governed differently by their charter. So Norwalk does not provide a lot of the actual direct services, but our commitment to over 90,000 residents is to ensure you know where to get those resources and how to access them. And I'll make reference to that a little bit more. The larger vision for the community services is to increase and to sustain the social well-being and health of all Norwalk residents. We provide oversight and administrative support to departments. We strive to unify initiatives and programs that directly affect the social well-being and health of our residents and support the quality of life through the lifespan. So we're talking from our little ones up into our seasoned ones. So I wanted to spend a little bit of time around this service delivery model in terms of how do we show up in the ecosystem and really within the context as a municipal agency, as a municipal entity. We are not a nonprofit. And as I always say that the funds that we use are taxpayers' dollars, whether locally, state, or nationally. So there's three ways in how we provide services here in the city of Norwalk. Number one, as you can see, is internal service delivery, in which we, the city, we actually provide the service. And Anna Vivian will make reference to some of these services, as well as Teresa. Our JRB, our Juvenile Review Board, that is a municipal function. The city of Norwalk employees provide that service. Our Fair Rent Office, we have our Fair Rent Coordinator that Anna Vivian will reference. And of course, our health department, and Teresa will speak to this as well, that you can go from city to city, town to town, and every health department has this niche. Every health department provides its services. And quite frankly, it's all based on, resources, capacity, and allocation, and the way in which that particular health department is structured. And then, of course, the library system, we are the library. And I always like to make note of it, when I enter Norwalk, the city runs two municipal-run libraries. And as you all know, within the taxing district, they also have their own independent libraries as well. And there's subcontracts. This is either with organizations and government entities. And so you're going to hear tonight as one of our action items is a state law requires cities and towns to provide services for low-income elderly, which is called our municipal agent for the elderly. So we don't get funding for that. We are required to fund municipal agent for the elderly. So it's by state law, we provide funding for this, and you'll hear about that tonight. Our WIC program, Women, Infant, and Children, right, Teresa? Did I get it right? Program. This is with an organization. So in our health department, our health department subcontract with Optimus Health, which is a large statewide community health center. We contract with them. They pay us to then provide this service. Whereas in other towns and communities, it can be a nonprofit, it can be another clinic, but again, in Norwalk, it's a city functioning through our health department. So we subcontract with them to provide the service here within our health department, which is exciting. So we subcontract, COVID-19 with a lot of funding came to the city. So we subcontract with our state to provide the COVID-19 resources, and Teresa may allude to our community health workers. These are all subcontracts with our government. Sometimes the contract is directly with the state, and sometimes the contract is directly with the federal government. Similar with organizations, sometimes the money goes through the nonprofit, and then the nonprofit, then subcontracts with other entities. In our case, it's our health department. And then there's the joint service delivery arrangement, where we as the city, we don't provide funding, but we work together collaboratively around providing services and resources to our residents. And Anna Vivian will talk about that a little bit more around our community resource hub and our care coordination. So here's the community services organization chart. And this has been adopted back in February of 2022, where we had the consultants from Evergreen Solutions looked at our work, looked at both on the city side and the Board of Ed side, and helped us kind of think about how we're functioning. This looks very different 5 years ago. So the three headings are our Human Services Department, and you can see all the different programs. Now, we won't have time to talk about everything specifically, but definitely over your tenure here as council, I'm sure you'll get to learn about these more in depth as we go on, depending on what's on the agenda. So you can see our three kind of pillar organizations that I call them, with our human services, our library system, and our health department. Something that I'm personally really excited about is our nonprofit Swing Space initiative. And we still have to give it a name. Nothing just comes to me and Vivian and I need to figure out what we want to call that. But but under my tenure in leadership, Norwalk, we're in a unique position between Connecticut's largest municipalities, which is one is Bridgeport, and then to the south of us is Stamford. And so oftentimes, Stamford and Bridgeport often become these regional hubs for social services support. And one of the things we observed very early on is, if the service didn't provide directly here in Norwalk residents will literally have to travel to either Bridgeport or Stamford. And oftentimes we're talking about our most vulnerable, our residents who may not have the needs and wherewithal to travel. For some folks, Uber, train, that can be very costly when you don't have those resources on a regular basis to access these services, which are often in the city of Bridgeport and Stamford. And so, Mayor Rowland endorsed this initiative where right here in City Hall, right in 202, and I invite you when you're here, please stop by and say hi to us so you can meet the team and see what we do day to day, that we have what is called the nonprofit Swing Space, where we work with larger regional service providers to actually provide office hours here in City of Norwalk, so our residents don't have to travel to Stamford and or Bridgeport. And Anna Vivian, I don't know if you're going to speak to this. If you could just make a note and just share, so I'm not repetitive. And that we're really excited that we have a variety of organizations based on availability and rotation actually come here and then work with our residents. Now, sometimes residents still may have to travel to Norwalk or Bridgeport, but we're really excited that at least the initiation, the interview, the assessment can really start here to alleviate that burden of traveling if they need additional services. And so that's like this big, wide overview of who we are. Again, you're going to hear more specifically, and we'll go a little bit deeper in some of our programs that we, as a municipality, through the community services, offer. So I'll stop sharing my screen. So Madam Chair, through you, if there's any questions specifically to Zeus, we're prepared to go through the other departments so everyone here can hear and go a little deeper on programming. Looks like we lost her.
I'm here. I figured.
Okay.
I have to go out. I figured it out. Were there any questions? I missed that part. See, none, Mr. Daniels, can you continue on with the agenda?
Sure. So we're gonna follow the agenda as written. I would like to welcome Teresa Argandesi. As I pointed out, Deanna DeMora, Health Director, couldn't be with us, but you are in good hands. She serves as the Assistant Health Director of Community Health. Good evening, Teresa.
Good evening, Chief Daniels. Good evening, everyone. Thank you so much for having us. We're very excited to spend just a few minutes. I'm going to start my little timer so I don't go on forever and ever. Just a few minutes giving you a very broad overview of some of the programs and services and background about the health department. And I'm happy to come back whenever you'd like so I can dive deeper into each and every one of these things individually. And then I'll hand it over to Brian to follow the agenda. For those of you that are new to this committee, Brian Weeks, our Director of Epidemiology and Informatics, often provides an overview, a status update on where things are related to all things infectious disease. And so I'll give a broad overview of the health department, let everybody know about some of our programs and services, and then Brian can provide an update on what's happening right now on the ground. So I also am going to share my screen. I would like very much to just keep myself on track. This is my goal with my slides. Let me just make sure I can get it into presentation mode. Here we go. There we go. So just a quick overview about the health department. This is a picture of our staff in 2022 when we were reaccredited. Our mission is to prevent and control the spread of disease, promote a healthy environment, and protect the quality of life within our changing community. And our vision is healthy Norwalkers thriving in a vibrant community. And so what does that look like in the nuts and bolts? This is our most recently updated org chart. It's very colorful. I won't go through everything, but it kind of outlines our different divisions where individuals are working. Right now, we currently have 42 employees. That includes 31 full-time employees and some additional part-time folks and a contractual person. But I like this org chart because it does really capture how our staff members are funded and how a lot of the work in our health department is funded. Approximately 25% of our operating costs comes from grants. And so you'll see the individuals and the staff members who are highlighted with purple boxes, lavender boxes, are fully grant funded. The blue boxes, or blue staff members, are city funded. Green, the couple green boxes you see are a mix of city funds and grant funds. And then our orange boxes include our Board of Health and our emergency response team. They serve on a volunteer basis. And so in addition to these staff members, we do have a 6-member Board of Health. And as I mentioned, we had a picture from our reaccreditation. We are nationally accredited health department, originally accredited in June 2014. And we were the first health department in Connecticut and the first local health department in all of New England. So we're still very proud that we're able to maintain that level of accreditation.
Teresa, can you just keep this up? Because I just want to highlight to the council, especially to the new members, that you call that lavender. So thank you for that. So I just want to highlight that so procedurally and based on our charter, I know the dollar amount has changed a little bit, but according to our charter, it's through the common council process, and then Council Burnett, or you can correct me too, but just want to highlight a point that through our council process, that the council has to authorize the mayor for a contract, but that's also accepting grants as well. So throughout your next 2 years, you may see us come back and say, this is a reoccurring grant, this is a 2-year grant, and it just may hit these 2 years, because as you can see, a considerable amount of funding comes from grants, where we are then required to go through common council to authorize to accept the funding. So just wanted to highlight that. Most of them are reoccurring or renewed, and they all have different life cycles, but just wanted to highlight that. So as we move through the next 2 years, you at least have a context of us coming back saying, you know, we need to reapprove this grant. It's been extended, amended, because that's the process in our charter. Councilman Burnett, did I get it right?
Absolutely. Covered it, financially correct.
Great, great. So we come a lot back, and Teresa and Deanna worked diligently both to identify grants, and we are a model. I always like to speak to Governor Lamont, highlighting our COVID response, and as you saw in the papers, shout out to Teresa, Deanna, and the entire team. That are we the highest city? I think we pair what Danbury, Teresa, in
Yeah.
terms of per population, having our population with the most COVID-19 vaccinations. And that really attributes to our amazing staff at the health department, who really rose to the occasion to keep our residents safe. So I won't interject too much, but I'm known to do that. Thanks, Teresa.
No, thank you. That's a great, I forgot about the piece that all of these purple or lavender boxes represent contracts that we may be coming to you to ask for authorization for. So thank you for that. And thank you for the shout out for our immunization action plan program. So if you look down here in the bottom, in the middle, the immunization grant coordinator and outreach worker, Chief Daniels mentioned our immunization rates. That one was actually for childhood immunizations for children from birth to age 2, all of their routine vaccinations. That's where we rank very high among other towns and cities in the state. We, along with Danbury, which we assist with in that region as well. So thank you for that shout out. Pam and Sarah and the team do wonderful work. So just a quick mention for our Board of Health. The board is, again, as we mentioned, 6 members. They serve in an advisory capacity and work very closely with Deanna and our senior management staff to help guide our work. There are some areas where by local ordinance, they have review and approval authorization for things like our fees and some other operations for the health department, but they really have been an amazing resource and advocates for health in our community. And so we want to elevate the work and the volunteer work that they do for us. The health department does undergo an internal strategic planning process periodically. We just concluded one, but I guess it's been a couple months now. The time seems to go really fast these days. And so these are our strategic priorities and goals for 2023 and 2024 before we revisit. And so I won't go into these in detail. I'm happy to answer any questions, but really these are some of the foundational internal priorities that we'll use to elevate, to strengthen, and to expand some of the programs and services that I'll talk about in a moment. And so we're looking at workforce development, building public awareness and trust, an evaluation of our existing programs and services to make sure we're meeting the needs of the community, and partnering with external partners to fill in any gaps. Foundational infrastructure improvement, so a lot of those plans and processes and policies that guide our work, and then making sure that we're using technology as effectively and efficiently as possible to streamline our efforts. Embedded throughout our strategic plan is a dedication to health equity and attention to climate change to make sure that those topics and that emerging area are really integrated throughout our work. Okay, so a little bit about our programs and services, and here's where I'll go into my fast forward mode. And so in terms of environmental health, we work really closely on lead poisoning prevention and abatement in the instance of elevated blood lead levels in children. We're raising awareness, providing information about radon in homes. We have a mosquito management program where we work closely with the state health department to make sure that mosquito-borne illness is well monitored and controlled, and that folks are educated about that, how to avoid mosquito-borne illness. in terms of ticks, we're trying to get the word out for folks about preventing Lyme disease. For individuals who find a tick on themselves or their children, they can bring them into the health department. We send them to the state for testing. Through the summer months, when folks are swimming at our beaches, we do beach water quality testing through our environmental health division. We serve as the staff, the city liaisons to the Shellfish Commission. And then we also have a rain gauge on the roof of the health department where we monitor rainfall, because that does impact water quality and shellfishing. So I could spend probably a half an hour just talking about the slide, but I'll just keep going. I'm just gonna keep going. Also on the environmental health side of things is our licensing and inspections. And so this is one of the areas where a lot of folks know about the health department. We're going into food establishments, farmers markets, itinerant vendors, to make sure they're following the FDA food code and keeping food at the proper temperature and handling food well, so that folks aren't getting foodborne illness. We also have housing inspectors that assist to enforce the housing code. So if we have residents who are experiencing challenges, or landlords experiencing challenges with rental units, to make sure that it's up to housing code, we can go in and inspect. We work very closely with other officials in the city to make sure that that any housing complaints are investigated and dealt with. They also do inspections for pools, salons, tattoo parlors, massage parlors, work really closely with the state on the licensing and inspection of preschools and daycares. We have a sealer of weights and measures that calibrates scales and other measurement items in the city where folks are being charged by volume or by distance or by pound. We also help with temporary events like the Oyster Festival to make sure that vendors who are coming in for a brief stay are also following all the good health and safety regulations. And then if in the rare instance when there is foodborne illness to investigate, we will check to find out if we can determine the source of the foodborne illness, and if there's any remediation that needs to be done, what we can do to help with that. In our community health strategy and education division, that's the best one, but I'm biased because that's my area. We do a variety of things: traditional health education and promotion. We work really closely with external partners, some of whom are on the call today, to work together to tackle some of the biggest problems in our community, or the biggest health challenges. We handle the communications for the department, so media outreach, our website, our social media outlets. And then we do look at policy, systems, and environmental change, so that when we're providing people with health recommendations, the community and the systems that they live in kind of support those and make it as easy as possible for them to make the healthy choices. Just some pictures of some of our community health staff at work, doing outreach out in the community, providing information, not in the office, always out there getting the word out about everything from eating healthy to protecting yourself from infectious diseases to washing your hands. A lot of, we're a bit of a jack of all trades in terms of health topics. Our clinical services division maybe is the other area where a lot of folks may know about the health department. That includes our vaccination services. And so we do childhood immunization. We do travel vaccines. So for folks who are traveling abroad and need exotic vaccination to keep themselves healthy. And then we also have routine adult vaccination as well. And then many of you know of our fall flu community clinics as well. We do outreach and education about immunization and vaccines. We have a sexual health clinic at the health department. We do a lot of work around tuberculosis control in partnership with other healthcare providers in our community. And then, as Chief Daniels mentioned, we do have the Women, Infants, and Children's program, one of the busiest and most important foundational programs in our health department. We see between 1,200 and 1,400 appointments each month. There's some information about our clinical, or some pictures of our clinical division. The top pictures are this nurse with the short blonde hair is Pam. She's the person who's out there working with pediatric providers and making sure that kids are connected to pediatricians and to vaccination, and that families have all the information they need. And then here on the bottom, these two pictures are from a recent event that we held in December for World AIDS Day to promote the importance of knowing your HIV status. We provided 4 different free HIV testing clinics, and some of the folks on the call were at our press conference and event. And so Dr. Chelsea Foster was spearheaded that initiative and really elevated that information to the public and to many of our decision makers in the community. I won't belabor our epidemiology division because Brian will show you that in action in just a moment. But in addition to all the wonderful work that Brian and his colleagues did during the height of the COVID pandemic, helping us monitor and provide surveillance around rates of disease, he also has done an amazing job at creating public dashboards for things like community health and well-being. We have an air quality monitoring dashboard on our website now so that folks can monitor air quality themselves. He provides so much background and data support for us so that we can make sure that the work that we're doing is data-driven. And then in addition to all the data and the numbers, he and his team are providing support and information and guidance to folks to make sure that infection prevention and control measures are in place and folks have the guidance that they need. Finally, we have our public health, not finally, second, but finally, we have our public health emergency preparedness division. They are planning for emergencies. They are training the staff and our volunteers for emergencies. They're working with other city agencies and partners to plan, providing education to the public, and then recruiting our amazing, amazing emergency response team volunteers. And so thank you to the folks on the call who are a part of that team and active members of our response during emergencies, but also staying prepared during those wonderful times when there aren't emergencies. And so here's just a couple of my favorite pictures from our COVID response. There's a lot of our emergency response team and preparedness folks in these pictures. On the left is our COVID clinics at Bowtie Cinema, and on the right is one of our COVID clinics at the Maritime Aquarium. And then finally, all the behind the scenes work that our folks do at the Office of the Director and in our administration division. All of those grants that Lamond was talking about are, we have financial reporting, we have contracts, we have programmatic reporting, we have accounts payable and receivable. And so there's a tremendous amount of administrative support that goes into that work, plus all of our cross-cutting initiatives around accreditation and performance management, and this nice long list of other activities that we have in place. Support from that team in Deanna's office that really make sure that we have the guidance that we need and plans in place to make sure that the programs and services I just talked about are running at a very high level of efficiency. And so I invite you to check out our website and follow us on social media. The phone number is our main number. They're amazing at the front desk. They can route you to wherever you need, and I'm happy to take any questions.
Awesome. Thank you so much, Teresa. We're going to just move right along and invite Brian. Brian Weeks, it says epidemiologist, but his official title is Program Director of Epidemiology and Informatics. And, we are so excited to have Brian with us. I think you're going to be quite impressed with the presentation. And we have usually made this part of a staple part of the community services agenda, and I think Chair Nicole and I have discussed that. We'll talk about what that looks like moving forward, but definitely wanted to give everyone tonight an opportunity to see the things that we do right here in Norwalk. So Brian, good evening, good to see you. Take it away.
Yeah, good evening, everybody, and thank you, Chief Daniels. Thank you, Teresa. Thank you all. So I'm going to jump right into it. I'm going to try to go through it quickly, but give an overview for those of you not familiar with this. Although you may have seen bits and pieces of this over the many a season that we have been dealing with respiratory illnesses. But I'll just go over this quickly and take any questions that you may have as well. So what you're seeing first on the screen here, this is from the CDC. This is the new COVID hospital admissions rate by county per 100,000. So again, it's looking at severity of illness because obviously that's what overwhelms the healthcare system, and is also an indicator, especially relative to the various COVID subvariant waves and variant waves that we've been dealing with what the story is. And so keep in mind with any data, there's always a time latency. And as you can see here, this data is up to date as of January 6th, so the week of January 6th. So it's for a 7-day time period. And then what you can see here is very colorful. And so typically when you see in the non-active seasons for COVID or the lesser active seasons, like the summertime, typically the map is green, and green is the lowest level, yellow is the moderate or medium level, and then orange is the high level. And so this is broken down by different thresholds, and basically relative to that rate, anything less than 10 is green, 10 to 19.9 yellow, and then above 20 per 100,000 is orange. And as you can see here right now, for most of the country, we're definitely experiencing, especially like the South, the Midwest, and then also the Northeast, especially, we're experiencing our COVID wave right now, courtesy of JN1, and I'll show you a visual related to that. But you can see the state of Connecticut, all 8 counties are in the yellow or moderate level. This is to be anticipated given this time of the season, because this is still the aftermath of all the major holidays. And again, keeping in mind that time latency. But as you can see, the Northeast is getting, hit hard to some degree in terms of, where you're looking in terms of the counties, right? You can see upstate New York definitely in the orange. You can see parts of Long Island, like Suffolk and Nassau County, in the orange. Parts of Massachusetts. But again, Connecticut counties are in yellow, including Fairfield County as well. And as you can see here, again, how to interpret this, the actions at the individual level that's recommended. Is again, the primary item is staying up to date on vaccine. And again, that applies to all 3 of the big illnesses, COVID, influenza, and RSV, which is respiratory syncytial virus. Maintain ventilation improvements, where you can. Avoid contact with anybody suspected or confirmed with COVID-19. Follow the isolation protocols, as well as anybody that's exposed, obviously following those recommendations, and anybody at high risk of getting sick, following up with the healthcare provider and speaking with them and figure out the best prevention measures relative to their circumstances. Now that's for all levels. Now for yellow and orange, those that are a high risk of getting sick, wearing a high quality mask or respirator, such as an N95, when indoors in public is going to be beneficial. But again, that's speaking with in concert with their provider, because obviously if somebody's experiencing respiratory, chronic disease or anything like that, it might be complicated by that. And then also, if you have any household or social contact with somebody at high risk for getting sick, consider self-testing to detect infection before contact. And so this is obviously something that, you've probably heard before. We've also hit home many a time in terms of just being prepared, especially as the holidays are coming up. You probably heard me like a broken record kind of mention that, especially in other meetings. And unfortunately, with these meetings, obviously, I don't think we've met since September. So I know it's been a little bit of a delay. In terms of just hearing that on your guys' end, but also we've been doing it in other avenues in terms of just getting that word and messaging out there. And so, the other thing just to mention relative to COVID, this is relative to the SARS-CoV-2, the virus that causes COVID-19, the virus concentration in wastewater. So this is the wastewater monitor you may have been hearing about. This is for Fairfield County. So we like to refer to this just to see, it kind of gives us a heads up on what's coming relative to the hospitalizations, because that tends to come afterwards. And so looking at the wastewater situation for Fairfield County for the most recent 6 months, you can see we actually peaked relative to this data so far. And so again, this is coming once a week. And you can see right now, relative to this data, we've actually peaked in late December. We're hoping that it stays this way. Again, there's always the potential for follow-up peaks too. An uptick, sometimes it's usually expected around spring break. So something that's a forewarning and just preparing ourselves for it. But at the moment, it seems to indicate relative to the wastewater monitoring. Still, what was driving all this, like I mentioned, is the JN1 subvariant of Omicron. And the CDC website loves to update whenever I go to it. But as you can see here, it's estimated relative to the time period of basically till January 6th, the week of that, or the 2 weeks, 61.6%. So more or less than 2/3 of the new cases that are popping up. But this is based on the CDC nowcasting model. So this is forecasting. So there's obviously, again, that time latency, as I mentioned before, with the data, and then also this is a forecasting model, so it's not perfect because it's basically inferring relative to the test that they do have that actually typed out, what sort of subvariant or variant it is, and then inferring what it means for the general population too. And then so with that said, looking at the big 3 again, COVID, flu, and RSV, you can see here, nationally speaking, for weekly emergency department visits by age group, this is looking at all ages. You can see again, that peak, because primarily the largest volume of weekly emergency department visits has been related to COVID and also flu. You can see how both of them have declined actually since the latter portion of December, and so we've actually seen this downtick. RSV, naturally speaking, has kind of plateaued as well, but it's a smoother curve, as we can see here. Fortunately, not as many weekly emergency department visits, but as you can see, flu has been kind of one of the primary drivers, along with obviously COVID. Now, it's a little bit different when you look at it from the state perspective. So this is from the state health department, specifically for Connecticut. Similar kind of surveillance. It's weekly emergency department visits for those big three, as looking at the percent of all emergency department visits. But as you can see here, COVID in the green is the primary driver here in Connecticut. And this is data up to December 30th. So it's a little bit delayed coming from the state health department side. But flu also, second, and behind it. And then RSV, but RSV is showing that it definitely plateaued. And so it's very fortunate that we're seeing this. But, relative to this data for Connecticut, although keeping in mind that the timeline's a little bit earlier compared to the others that we've been looking at, it's, showing that, activity relative to COVID has been our primary driver here. And again, that's related to the JN1 variant. So very fortunately, we got the word out. This was in the Norwalk Hour. This was kind of looking at not only the Norwalk Hospital, but also from the health department perspective in terms of getting that word out about, Fairfield County being in that yellow level. And so also the recommendations tied to this. So, just getting, different media that we can kind of find and different medium, we can get these messages out there. We definitely take full advantage of that. And then along with that, and alluding to, just the funding and everything else that kind of supports this work, not only has that resulted in us, getting COVID rapid tests that we distribute to the community and different community partners to reach different populations that would obviously benefit from this. We also still provide contact tracing support relative to COVID-19, which is actually kind of rare at this point because most communities are not providing that service. And so we are following up with cases, especially those that are very young, because they obviously would potentially be causing, potential clusters or outbreaks or exposures in daycare settings, but also the elderly, so that includes the senior centers and also working with the nursing homes too and providing guidance and support. And so, that's something that's accessible in this form. If anybody does an at-home test, they want guidance, we're still happy to provide that service, as well as in addition to that, if there's any sort of community partner that has a cluster or they want some just additional guidance or want to stay in the loop about what else they could do, by all means, they could submit via this form on this website, and you can see it right here in terms of the link. Again, that's the norwalkt.gov/testing. Very simple, easy link. And that service and that support can be requested, and we're happy to provide that. And that's again addressing cluster and outbreak situations anywhere in Norwalk, in nursing home, daycares, other facilities. We also provide support to the public school system. Obviously the rapid test, as I mentioned, is just obviously the different information that we make available to the community with our website, with the media. Obviously the COVID data hub, which you may be familiar with from in the past. Everything else in that nature, in our social media and other activities and outreach that we do. So I just want to emphasize that point. Thank you again for this opportunity to share this. If you have any questions, I'm happy to take them now.
Thank you, Brian. I really appreciate it. So as you all can see, we stay very, very busy, but doing all good stuff. So Chair Ayers, we're ready just to move on with Human Services. Is that okay with you?
Please do so.
Thank you. So I'd like to welcome Ana Vivian Estrella. She is our Human Services Director, and she's going to share on the social service side. I just want to bring to your attention that prior to my arrival, Norwalk, the city of Norwalk did not have a social service department. We relied years ago on the state Department of Social Services, and then many years ago it left, which again, as I alluded to earlier, pointed out that our residents were served either through Stanford or Bridgeport when it comes to state services, and of course through our local nonprofits. And so while we don't provide a lot of direct service in the sense of residents coming to City Hall for specific services, but we have found an innovative niche and an innovative opportunity to really fill a gap of how to ensure Norwalkers know when they need help, where to go. And since Ana Vivian's arrival, she has taken it to a whole nother level, and she's going to share what encompasses human services and then specifically highlight some of those programs. I think you'll be pretty excited to hear about that this is happening in our great city. So take it away.
Thank you so much for the introduction, Lamond, and I am also going to share my screen. So So please let me know if you can see my screen. Did it pop up, the presentation?
Yes.
Yes, perfect. So this is just a nice infographic regarding what we're going to be talking about and the scope of the Human Services Department that we have here for the city of Norwalk. And really, the mission is to promoting a coordinated system to serve Norwalk residents. When we look at the Community Resource Hub, and Lamont has talked about this a little bit, but it was rebranded and relaunched last year or a little bit over a year ago. And it's an accumulation of 2 different programs that were launched during COVID era. But the emphasis is that the Community Resource Hub helps Norwalk residents in need identify, understand, and navigate available support services and resources. So Norwalk is resource rich, which is great. It's phenomenal for our residents, but that can get a little tricky. If I'm looking for services for the first time, it can get confusing. It can be daunting. It can feel like I'm still out there by myself trying to navigate it. So we have a no wrong door approach. Residents can walk in, call, submit an online form, email us, really any way they've heard from a friend, they came with their friend. Whatever way they come to us, we'll then reach back out to them in a timely manner, usually within 24 business hours. And we engage on ongoing outreach efforts. So we attended 17 community events last year. We conducted several community presentations, and we created different online printed material in 3 different languages. So we make sure that everything that we produce is in English, Spanish, and Haitian Creole. And we participate in community meetings and work groups so that we could provide what we're seeing on the boots on the ground. And what that looks like in the calendar year 2023, we served over 986 households. So those are independent households that came through this program seeking community services. And when you distill it down to how many people are within those households, it's over 2,000 people. So that just goes to show that this program is really becoming a staple of the Norwalk community. Lamont dubs it the local 211, which I think is a perfect description of it, because you can get a lot of information online, but it's not the same thing as talking to a human that can help you sift through all of that information. And also tell you what to expect. What is it going to look like, feel like when you enter that community service space? Next, we have early childhood. So that office maintains the little libraries, a provider guide, a list of resources available for our youngest residents. And that's the 0 to 5 area. So these are really our little ones. This is word heavy, and that's because I think that historically the early childhood coordinator, people didn't always understand the role that she plays, and it's Mary Oster, and I'm sure a lot of you have interacted with her throughout the years, but she maintains a directory of all the center and family-based services and publishes a childcare opening. So when families are looking for childcare, they can refer to this guide and say, okay, this is the one that has space, and it indicates whether they take care for kids, if they have a sliding scale. And so even though it's a one pager, it's really family friendly so that they can make the best decision on how to get care for their children. She also does resource guides and makes herself well informed of what's going on in the early childhood space with all of the providers and services. And if you go to the early childhood webpage on the city, we just did an entire rehaul. It's beautiful. It has diverse pictures, and it's just enough information where a new parent or a current parent doesn't feel overwhelmed, but leads them in the right direction to get more information about every single topic. She also monitors our early care and education programs that are funded by the Child Day Care contract. So she does the fiduciary monitoring as well as the programmatic monitoring. And she, as mentioned, she maintains the little libraries that are various locations. So barbershops, outdoors, community restaurants, delis, different things, and people can ask to be added to that list. And so She's always in search of books that can be provided into the little library, and she has a robust volunteer base that looks out for this and also helps supply those little libraries. She's a member of different initiatives, the Sparkle app, and making sure that our youngest residents are taking the ASQ, which is a tool that helps parents and families see if their child is on task, which is a moving target, right? Development for a child that young, it evolves and it moves with them. And if through that app a child is identified as needing extra supports, they actually automatically get connected to the supports and someone that can walk through different options for that family to get their child up to date developmentally, or connect them with the appropriate resources if they need ongoing assistance. She also advocates, so she's a part of the statewide organizations that look at policy decisions and stays up to date with any policies that could be impacting our local providers and disseminating that information to them. So she was vital in some of the health department initiatives to get PPE out there, make sure that the childcare providers had, you know, masks, that they had gloves, that they had what they needed to keep going, because as we all know, this was a service that needed to continue so that our system, right, our community system could continue, because people can't go to work if they don't have childcare for their babies. And so that was an essential service during the COVID times, and this became a vital role for that communication between what the city was providing and what the providers needed. So Fair Rent, the Fair Rent Office provides information on landlord and tenant rights, mediation, and receives fair rent complaints. In the calendar year, we saw 429 households come through this department. And these are the things that we've identified that people come to us the most about, and we also encourage them to reach out so that preventative measures can get put in place whenever possible. So if they received a rent increase that seems excessive, if they're at risk of falling behind in rent, so that we can then connect them to Community Resource Hub and other options. If they fell behind on rent and are afraid they're going to be evicted, so we can help them connect, but also give them the information on how the eviction process works. If they received court documents and they don't know what they mean, or if they haven't received their security deposit. That seems to be a really big thing, that landlords are not always sure or don't understand that they need to provide the security deposit within a certain time frame. Sometimes the tenants don't know how to request it if too much time has passed. And so he works on all of those topics with the tenants. On the landlord side, he also gives them information about their legal responsibilities and rights. Not all landlords are trying to do excessive rents, so we try to provide guidance on best ways, best practices on how to raise rents if they do want to be able to make updates to the unit or updates to the apartment, because it's an investment most of the time for these landlords. Again, doesn't mean that we're encouraging them, but we're trying to provide guidance so that it's done in a more responsible manner, and so that there isn't a fair rent complaint later on if the rent is raised excessively. And those mediation services really have helped keep down the fair rent complaints from having to be escalated to fair rent hearings. And so although we've had a number of fair rent complaints, I believe all of them up to date have been able to be resolved before the hearing process has needed to be activated. The ADA transition plan. So we have an ADA coordinator, and he works with the city departments to make facilities and programs more accessible as possible for everyone, all of our residents. In 2013, the transition plan outlined 332 items that could be addressed to make the city more accessible. Since then, a portion of them have been completed. I didn't want to go through the entire plan. It's on the city website, and we can go into detail about it. But I wanted to at least give you an update about the things that are happening right now and that are projects that are on the docket. So an emergency egress route from the wheelchair seating in the auditorium. Right now it's incomplete, so we wanted to do our due diligence to make sure that it gets connected to the sidewalks So if those that are in a wheelchair or that have some kind of mobility issue would not have to travel over the grass, which is a little, it can just be really hard when you have mobility issues. ADA compliant signage for City Hall and the Health Department buildings. During COVID, a lot of offices were changed. So this is an update that just needs to happen so that it's easier for those with impairments to get around the buildings and know where they're going. Ramp construction at the East Avenue entrance outside of the concert hall. So this was a project that was already on property management's docket. But in an effort to, again, to make sure that everything's accessible, a ramp will be constructed. So for those of you that go to the tree lighting ceremony, there's that platform that's out there. A ramp will now be constructed outside, so that way those with disabilities will be able to participate in an event like that. Pasture Beach. So there was all of that renovation that happened in the parking lot. A small oversight that occurred was that there wasn't a curb ramp from the middle of the parking lot to where the pay kiosk is, and also to the handicap parking spots. And that was just because it was outside of the scope of where they were doing all of that work. So this department was able to work with Recreation and Parks to make sure that this was completed. And so those with wheelchair or mobility issues will be able to enjoy the beach and go straight from the handicap parking to the kiosk to the beach and not have to go to either end, which is where the existing curb ramps were. The South Norwalk Railroad Station will be working on putting in power doors from the garage level, the first garage level, and also one on the platform. Right now, they're really heavy and they would be really difficult for anyone who has any kind of physical disability to open and go through it. And so this is a project that's on the docket to be completed as well. All of this is made possible through an annual capital budget request, and it's all done in collaboration with the city departments. So these are the items that we have that we will be using ADA funds for, but our ADA coordinator works with all the other departments to make sure any project that they're embarking on has an ADA component to it, or make sure just to look it over, make sure that everything's being done to compliance, because these projects are huge and they go through a lot of hands. And if you don't have someone specifically looking at it from the ADA lens, things can get lost. And so that's where our staff member is really doing his due diligence to be a partner with all the other departments. Youth services. So our youth services office provides resources and opportunities for youth skill building, wellness, civic engagement, and restorative justice. And so I broke it down to a couple of big buckets because it does do a lot of different things. So Summer Youth Employment Program last year, 123 youth were employed through the city of Norwalk during the summer, and were connected to job skills training, employment, and civic engagement. And that includes the Mayor's Youth Council. The Juvenile Review Board served 85 youth last year, and various parts of this is Peer Connection. The JRB Victim Support Assistant just started this year. And that's a community-based diversion and prevention program for youth that may otherwise be referred to the juvenile court for minor offenses. And then Care Coordination served 119 youth. And this program aims to empower youth by giving them the opportunity to target their own positive outcomes. And they do that by assessing the youth's needs, developing a plan, and coordinating services. And then these are just a couple of other little department roles and a nice picture of the staff that's included in this department. And so we have the municipal agent for the elderly, the senior services contract, which currently goes to FCA, and we'll be touching upon later on in this meeting, so I won't go into specific detail. The mini grants program that was initiated this year, which was for smaller nonprofits, to be able to get the opportunity to get some grant funds and infuse some funds into new initiatives or existing initiatives. And the Swing Space calendar that Lamont was talking about, we currently have the Workplace, which has the hubs in Stamford and Bridgeport. They're here on Mondays and Tuesdays. They do the introduction to the suite of workplace services. They'll help them with their resume here. And because of this partnership, the workplace has brought down some of their premier services directly to Norwalk. So there was an initiative where they brought down their temp to permanent staffing agency to Norwalk, and residents were able to sign up and meet with that staff here. They have plans to bring down their platform to employment and their reentry programs to Norwalk, to that space, either on a monthly basis or a bi-monthly basis, so that Norwalk residents won't have to travel to Stamford or Bridgeport to reach those services. CRE which is Connecticut Institute for Refugees and Immigrants. They are here on Wednesdays and Thursdays, and it's their team that's serving the Ukrainian refugees. And so they're serving all of the residents in Norwalk that are refugees, and they're providing case management and also connecting them to social services agencies as needed. And the Urban League of Southern Connecticut is here on Fridays, providing different services to our Norwalk residents as well. So you can see it's just bringing a suite of different services that otherwise our residents would have to travel to Bridgeport, to Stamford to access. And so many people get lost in that transaction. So we've done our due diligence to really try to encourage and promote these partnerships for them to use this space, to work collaboratively amongst each other and with us, to elevate the work that they can be doing and are doing in Norwalk. That is the best I can do to provide broad strokes for Human Services Department. And I will stop sharing my screen so that we can, if you have any questions.
Thank you so much, Anna Vivian. I just want to highlight that the swing space calendar that she referenced, these are formal arrangements, so they are contracts. So at no cost to the organization, but they are formal arrangements. And we're always recruiting these regional programs. So again, as we identify potential partners that we believe will serve our community well, the contracts will go through this committee should we identify additional resources that are not otherwise served here in City of Norwalk. So Madam Chair, I'll turn it back to you for any questions specific to what was presented, and then we'll take your guidance to move forward to our action items for this evening.
Thank you. Are there any questions from the Common Council? Okay, Barbara, just give me 1 minute. I omitted to say in the beginning of the meeting, because I couldn't see everybody's beautiful face, but Councilperson Jalen Seed, as well as Councilperson Nora Nadelski-Eichner are also on the call and have been with us since the beginning. So please, I apologize for not acknowledging you in the beginning. Barbara?
Thank you, Madam Chair. No questions, but I do just want to take a moment to thank you for those presentations on behalf of the new people. But for those of us who've been around, I just want to say I really appreciate it. 5 years ago, Lamond, when you first came on, it was just you, right? And all of these, most of these programs existed, right? But what you did is you brought everyone together, you coordinated the programs, and your outreach to the community, has assured that everyone who is in need in some way is getting their needs met. And I have to commend you again. I know I have done it many times, but this is the most important work we do in the city, is to take care of our people. And you've just done an incredible job. Your entire staff is dedicated, professional, and has just done incredible work. So I want to thank you all, commend you all, and Lamont, thank you for your leadership.
Thank you, Barbara. Melissa?
Yes, echoing Barbara's comments, I really appreciate all the work that all of you have done to help educate us, all the new people coming in on how the city works and the presentation. So I'm so grateful to be on this committee, and I thank you for all your work. I did have one question for Anna Vivian. I personally myself don't have children in the school system, but I know that there's a group called the Family Center, which seems somewhat similar to the Human Services Hub. And I just was wondering when would I choose to send my constituents to one? When might I choose the Human Services Hub? Can you just, show me the differences a little bit more?
Absolutely. So Family and Children's Agency is actually a service provider in Norwalk. And so they provide home care services, therapeutic services. There are a contract for our senior services. So they have direct services for the residents. I would say for the Community Resource Hub, what it is that we're taking them in, we're letting them vent, kind of get everything out there. And then we're saying, okay, you're looking for this. And we might refer to FCA. We might say, okay, you're looking for home care services, or you're a senior in need of case management. This is who you reach out to. This is the phone number. This is the person you're going to ask for. So we might be connecting to FCA, but I think the difference is that FCA is a service provider. If it's something outside of their scope, we're not expecting them to be experts of all of the services that Norwalk provides. That's where the Community Resource Hub comes in place, right? So the staff here make it a point to build relationships with all of the service providers in Norwalk, figure out their intake procedures, figure out what is the scope of what they serve, because there's different age brackets, there's different income brackets, there's different ways that the service is being provided. And the more information that we get, the better that we can guide the residents to the right service. So it's not a one or the other. I would say you can always refer to both. And we might just follow up and say, yes, absolutely, FCA can take care of it. Or it might be like, FCA can do this part. They could provide the therapeutic services, but for your food and clothing need, you're going to go over here. And this is how you reach out to them. I hope that makes it a little bit clearer.
It does. Thank you. I appreciate it.
Absolutely.
Any other questions from the council members? Okay. Again, I would like to thank Chief Daniels and his team for presenting it. I know it was a little lengthy, guys, but I felt it prudent to start off this year with all the necessary information so that we know what our departments are doing and how we can give oversight and assistance to them. So that's why I asked them to do PowerPoints so that we can reference things and, visually see things. So thank you guys for presenting as you have tonight. We do have a few action items for tonight. The first two are under the health department. I'm going to read 1A and 1B together because they coincide with each other. 1A, authorize the mayor, Harry W. Riley, to execute any and all documents necessary to apply for and accept funds from the Connecticut Department of Public Health in the amount of $495,935.38 for the period beginning March 1, 2022 through March 31st, 2026 for the enhanced detection, response, surveillance, and prevention of COVID-19. 1B, authorize the mayor, Harry W. Riley, to execute any and all agreements, documents, instruments, and amendments as may be necessary to implement enhanced detection, response, surveillance, and prevention of COVID-19 activities for the period March 1, 2022 through March 31st, 2026. Chief Daniels?
Thank you so much. So Teresa Argandesi, our assistant community health, our assistant health director, can give some context for these two particular items. Thanks, Teresa.
Sure. So these two items are part of a state grant that the acronym is ELC, but it stands for Epidemiology and Laboratory Capacity. And so actually this is a grant contract that was authorized by Common Council previously in December 2021. The original start date was set to be June 1st, 2023. And because of contract delays and other administrative things at the state level, it was supposed to end on May 31st of this year, but the state was able to extend the grant period until March 31st, 2026. So this is a grant and a contract that will help us with some of the activities that Brian discussed in terms of monitoring and surveillance for COVID-19, and then also that support and guidance in terms of contact tracing, case investigation, providing information and guidance to organizations looking to prevent the spread of infection. It's just that the state has allowed us a no-cost extension because of the lateness of the start of the contract period, has provided a no-cost extension for a couple more years. So we're very happy to have that opportunity to continue this work for a little bit longer.
Thank you. Are there any questions from the council?
Yes, Madam Chair, I do have a question.
Yes, Mr. Burnett.
Thank you. Just in relation, as a follow-up to the statement made during public participation, will any of this funding go towards distribution of test kits, masks, et cetera, related to COVID-19?
Yeah, so I know, Brian, I'll take a stab at this and then let me know if I've gotten anything, if there's anything to add. But I do know that we have a plan to allocate funds to test kits so that residents can get access to COVID-19 at-home tests. I'm not sure that we have plans right now to purchase and distribute masks at this time, but we're definitely can take that back to the team and talk through that to see if it's an allowable expense and something that we can discuss. And then also in terms of outreach and education and communication materials, we work very closely together on all the grants that we've discussed, that we operate on. There are other funding streams from the state and other funders that are really specific to education, outreach, and communication. And so we'll be working closely with those funding streams and this one to make sure that that information's out there in multiple languages at different locations throughout the community, as well as through our community partners to get the word out.
And Teresa, can you speak to, I think by the end of the year, maybe for the past several months, I know we received several thousand test kits. Do you have a count of how many we distributed just in the last couple of months? That we're constantly getting tests from different, mostly from the state. So the goal, Councilman Burnett, that if we can get them for free, we kind of like that better, so we can allocate funding for other specific needs as the health department sees fit. I know we did several thousand.
Yes, I think our most recent allocation, which was either the 4th or the 5th that we had done in terms of distribution, our total was 4,000. I think we've given out about 3,500 of them so far. And that's primarily through a lot of our community partners, reaching out to those folks. I know we did give out several hundred this weekend at a food distribution. And so we're finding other opportunities to get out there in the community, provide the test kits, but then also guidance for folks on how to use them and where to go for more information if they need help.
And Councilman Burnett, we also, at the end of the year, like it was a long time ago, at the front desk, we've made a public appeal that as people enter City Hall, if they would like a COVID test, we want to make those available. And then always give them out to our Norwalk nonprofit partners, and including Norwalk Housing, to get them out as widely as possible.
Great. Thank you for that response.
Okay, thank you. I stand corrected. I didn't move the item. I read the item, but I didn't move the item. So
I'll move that.
thank you, Barbara. Is
You're welcome.
there a second? Okay, it was moved by Barbara. I see Melissa seconded. We've already had discussion, so we will vote on 1A and 1B. All in favor? Raise your hand. Any nays? Any opposition or abstentions? Okay, the motion moves unanimously. I also like to say, just as a community provider, I have reached out to the health department several times and said, we're having a big event. Can you please provide us with COVID tests? And they have been very gracious, and we've gotten the test out just to be cautious of people being, in spaces with each other. So they are always willing to make sure that those tests are getting out to the community as often as they possibly can. Okay, continuing with our agenda, community service. A. I will read the motion. I will read the agenda item and move it. Authorize the mayor, Harry W. Railing, to execute any and all agreements, documents, instruments, or amendments as may be necessary with Carver Foundation, Inc. to provide financial assistance for low-income families whose elementary school age children attend Norwalk Public Schools in the amount of $500,000. ARPA account noted. Is there a second?
Madam Chair, I'd like to move that item.
It was moved by Greg and second by Mr. Sutton. Mr. Daniels, is there?
Yes, hi, good evening again. So I'll give some context, and I'm joined by Ms. Novelette Peterkin, who is the CEO of Carver Foundation Incorporated. The city was approached by the district for support to help provide scholarships, financial assistance to the after-school program, and Ms. Novelette can speak to. They are the vendor for the majority of that after-school program. And the amount is $500,000. I do want to emphasize that the funding is a one-time funding to support these youngsters, and that we've had several conversations with the district due to a grant, the 21st Century Grant. It was discontinued, but no sense to us. So the city has made a commitment through this $500,000 to support, to help keep these young people engaged in after-school programs. This does not fund the entire program. The district and Carver also supports this program. So this city funding is not the entire program. It's just a support to help support the program for this year. And so through you, Madam Chair, and you all have the accompanying document. We'll love to have Ms. Novelette kind of give an overview of the program, why this is important, and then most certainly we'll entertain any questions. Good evening, Ms. Peterkin.
Good evening. Thank you all for the opportunity to be here on behalf of Carver families, especially those who are financially distressed. So Carver operates more than 50 before and after school, summer, and community programs. Last year, we served 2,889 unduplicated students, and there were more than 270 that participate in 2 or more Carver programs. I'm here as Chief Daniels just informed you all that I'm here to ask the city for $500,000 to help with the rising need for the subsidies to families. Those are the families that are receiving free and reduced lunch for our elementary school program. This request has nothing to do with our middle and high school program. Carver is on track to serve more than 1,500 elementary school students, and we have a budget that serves, the total budget for the elementary school program is $3,963,724. The Carver After the Bell program, the cost is $2,500 a year, which is about $250 a month to families. And with over 50% of Carver students that qualify for free and reduced lunch, Carver issues discounts ranging from 30% to 50% off the fee for the program. And so some families need additional funding beyond the additional support beyond the discounts that we offer. So they also get financial aid. That means that some families will come free because they cannot afford. And last year we gave out $886,000 in discounts and financial aid, and another $125,000 went uncollected. Now, this is not sustainable for us. That's why we went to the district, because we like I said, $3 million, almost $4 million we put into the elementary school programs. If we're not able to collect some fees, then I would have to raise an additional $1 million on top of the $10.3 million budget that we do have to raise money for. So the discounts and financial aid is estimated about $722,000. As Chief Daniel said, there's another $235,000 for our 6 of the 9 fifth grade programs that we do facilitate with the district that didn't get the funding that was needed for the program, and that's another $235,000. So the need is about $957,341, and we're asking the city for, to help us with $500,000 of that. We're talking with the district and other funding sources to see how we can support the remaining support that's needed. Just to I know it's in your packet, but 1 in 5 of Norwalk Public School students are Carver students. 70% of Carver students are elementary school students. 52% of Carver students are free and reduced lunch status, and 1 in 5 of Norwalk students who are free and reduced lunch status are Carver students. 53% of all NPS fifth graders are Carver students. I just wanted to make sure and then 37% of Carver students are from 06854 zip code. That's our top zip code of service. We're extremely grateful for your, we're extremely grateful, for your positive response to this proposal and support of Carver families who are most in need. So thank you for allowing me to speak with you tonight.
Ms. Peterkin, that zip code is that South Norwalk?
Yes.
Okay, wasn't sure. Thank you. Turn it back over to you, Madam Chair.
Councilperson Wiggins?
Oh, I'm already on mute. Oh. Hello everyone. It's a long meeting. I have a few questions, and Lamont, I asked you this on another committee call, but I hope you have the answer by now. And the first question is, was it an RFP? What was the process in organizations, receiving these type of funds? And the reason why I ask, because I think about all the other opportunities that the city of Norwalk has, like the CBDG grant, Anna Vivian mentioned the grant with the mini grant, the $10,000, last year's ARPA. What's the process for an organization to come to the city to submit a proposal like this?
Right, so we entertain requests regularly. Specifically to this request, as I point out, the district approached the city for support. Carver Foundation is the vendor for the after-school programs. So specifically to this request, there wasn't an RFP because they are the vendor for the after-school programs. In terms of, to your other questions, Councilman Wiggins, in terms of RFPs, as you are aware, our ARPA program is a competitive process. Our mini grant program is a competitive process as well. Once we have identified the program, we work diligently through the media, our social media platforms, and as you are aware, our Friday call to get the word out when the city provides grant opportunities. This specific request came through the district, so it would not suffice as an RFP because Carver is the vendor for the after-school programs.
I'm sorry. When you say the district, what does that mean? I'm once again.
Norwalk Public Schools.
Oh, the Norwalk Public School District. Okay.
We just say the district.
All right.
Oh, if I can interject, so Carver has operates after school programs in every school in the district. So we partner with the district and we provide before school, after school, in all the elementary school, and we provide after school program in every middle and high school in the city. So as we said, we are serving over almost 3,000 students in our programs, and we provide, not only do we provide affordable opportunities, middle school and high school students only pay $200 a year. We raise all the funding for that. The district does provide support as well. And then most of our program have a later bus that take the students home once the program ends. So we're trying to remove all the barriers for students to participate. So if you don't have a car to take you home at 3 o'clock, you can't participate. So we try to remove all the barriers, and we work with the district. We partner with every principal in the city, including side-by-side charter school as well.
Mr. Wiggins, are you finished?
Yeah, I'm good.
Okay, thank you. Councilperson Burnett?
Yes, thank you, Madam Chair. My question is directed to Novelette. It is great that we were able to identify the funding through our ARPA grants and look at our ARPA funding allocations and identify this money. But as Chief Daniels indicated, this was a kind of a one-time opportunity because, as you know, our ARPA fund has exhausted. What is the plan going forward? What is the sustainability plan? This time next year, if the situation remains the same, what does the Carver Foundation plan to do to address this issue next year and going forward?
So we're working with the district on this because we are bringing, like I said, $4 million to the table. Norwalk Public Schools bring $531,000. So we're working with the district to help solve this problem. Last year, we covered this with our paying down our reserves. We understand that this is not sustainable, and so we also are talking, are going after other funding to be able to help families. So so you understand the way this works is that we have a budget that supports the program. This caught us off guard. All these families, like we had 200, I think the district gave me $200,000 to provide subsidies for students. And, 4 months into the year last year, it was just, we just blew through that. And so I had to go to the board. I said, listen, we have a problem here. And our board did not want to abandon our families. And they said, listen, what we'll do is that we'll cover it by paying down our reserves, but next year we'll have to deal with it. And so we talked with the district about it, and we're one of the avenues was to go to the city to help with that. And then we're working on next year with talking to other donors and seeing some of the other funding that we'll be able to go after.
Councilperson Wiggins?
Yeah. So that I actually was gonna ask that same question, but I actually forgot it. But thank you, Greg, for bringing that up, because that's one thing I was thinking about was, so I know it's just for the middle school program, but it's the total budget of $957,000 plus,
Oh, it's not middle school. This is only for
elementary. I'm sorry. Yeah, I have it wrong. I don't know why I said middle school, but elementary school. So if, say for some odd reason, there's no money raised, so all of these kids will be out of like the after school program. Like, how does that look if it doesn't happen? Obviously, we want to encourage it to happen, but how does that look? Since this 500,000 is going to be gone.
Okay, so let's put it in perspective. So we have our elementary school program is about $4 million is the budget. This is not, we're not asking you to fund the program. What we're asking is that, so in the budget, we expect families to pay certain amount of money, right? $250 a month. Some can pay, some can't pay. And so what we're trying to do is to help families who can't pay so that they're not, we're providing the discount to them. So for example, someone may be able to pay $1,000 a year, so we have to subsidize the $1,500. And so that's what adds up to, the 900 and something $1,000, because we're talking about 1,500. We have over 1,500 elementary schools kids that we serve, and about 600 of them are in need of subsidy. And that's what we're trying to do is not turn families away. We don't turn anyone away, but to help those families. And most of some of these families, they can't apply for Care for Kids. They don't qualify. They don't, there's all these reasons why they cannot afford to pay the $2,500, or some can pay $1,500, and so the subsidy is $1,000. So what this is to help them on the part that they can't pay. And we don't want to, if we turn our backs on those families, those are the families who need us the most. So we are trying to find a way to advocate for them. They're not here to advocate for themselves. We're trying to advocate for them to be able to cover that and make it possible that all the kids who need the services, who can't pay, still can participate. And so the district has a big part in this, and Carver is doing their part as well. So I mean, the district gives us, like I said, $531,000. We have to talk about, what that looks like next year.
Okay.
Hopefully I answered that question. It's the subsidy that families pay. It's not we're not asking you to cover the budget for the program.
No, yeah, no, I understand that. It's just really just they can't, if they can't afford it, it's like we can't just keep paying for it. We got to find other options to kind of like pay for the people.
Yeah, and we're working on that. To see this, like I said, this caught us off guard because we used to remember we took over after the bell in 2019 from the district, right? Adamowski came to me and said, listen, we need for you to do this. You're in the business of after school. You'll do a better job at us. And then when I looked at the books, I said, listen, you have to cover the subsidy because that's the problem. Why you have a deficit is because, family, you cannot run the program on relying on families to cover the fees. And so $200,000 was what was negotiated at the time. But then the pandemic hit. We did get money from OEC, and then we went from having 9 programs to 22 programs. There's 22 elementary programs. We grew after the bell from 9 programs to 22 programs over the 3 years. And so it caught us off guard basically. And so we're working with the district on what that looks like going forward.
Councilperson Dunn, I see you, but I just want to interject.
I have a multifamily fire I have to go to, so I'm gonna apologize. I have to go. Not in Norwalk.
Well, we'll check with you later. Please go and be safe.
No problem. Thank you. Danbury to Norwalk. Thank you.
What I want to say to this committee and really the general council is we received information not too long ago about the ALICE population and what that means and who those people cover. A lot of the children that are unable to meet the fees are ALICE population children. So this is a conversation we started last year. We need to continue to educate ourselves and continue that conversation to really understand what the ALICE population in Norwalk looks like and what their needs are. I think we talked about helping them with, I think it was for Alliance and person to person, helping them maybe with back rent and stuff. But another need is childcare. And so I think this is a continued conversation that the council needs to have to fully understand the ripple effect of what the ALICE population, their true needs are and how the city can or cannot assist them. Are there any questions? Mr. Wiggins, one more, go ahead.
To your point, Nikki, because you bring up a valid point. When dealing with that population, like to say that this 500,000 is the last bit of money going, that will be used, for the Carver, we got to really consider, how can the city be a partner in getting more funds to support these type of initiatives? It's extremely important when dealing with that that population, because it's like if we don't kind of support them, like how would they ever get out of this hole, right? So it should be a continual thing. I don't know how that looks, but it should be a continual thing. It shouldn't be just, oh, we have this 500,000 and that's kind of be it. Like we should be able to support Novelette and the Carver, right? Like it should be a consistent thing especially if it's dealing with this population, because just imagine they don't get the money, then what? Like we back where we started. So
well, Councilperson Wiggins, we are right in the beginning of budget season, so we look forward to you bringing more commentary around how the city can adjust their budget around, underrepresented areas and things of that nature. But we need to move on because time is sensitive. Are there any other questions on this item?
Can I just add one thing? Just so the council knows, Carver is never, we're not the one who identifies students, right? All the programs that we run, we do not select students. The personnel in the school identify the students who meet the criteria of having been academically challenged and economically challenged as a priority. And so just so that we aren't in the business of selecting the students, but we set the criteria, and those staff people at the school are the ones who select the students who are most in need. So just so you know that.
Thank you. We're going to call for the vote at this time. All for it, please raise your hand. It is unanimous. Thank you. Thank you, Carver Foundation and Ms. Navalette, for being with us this evening.
Thank you. Thank you all.
The next item is authorize the mayor, Harry W. Railing, to execute any and all agreements, documents, instruments, or amendments to reappoint Family Children Agency, Inc. as the municipal agent for the elderly for the period of July 1, 2024 through June 30th, 2027. Can someone move this item? Barbara, thank you for moving that item. Chief Daniels?
Yeah, so just to, again, I love the theme, make the connection. So this was an RFP at the time 2 years ago when the city had to hire a municipal agent for the elderly. So we did an RFP, many organizations applied, and through the review panel, FCA was chosen. And so on the city side, we have been very pleased with FCA's work as the new municipal agent for the elderly. With that, I am asking the council to approve a 3-year contract so that we don't have to come back annually, because they've just done a good job, and nowhere in the legislation that we have to identify someone year after year. And so I ask for your approval and your support to reappoint the municipal agent for the elderly FCA for a 3-year contract. The funding is already a line item in my budget for Councilman Burnett. I wasn't sure if I needed to identify that because it's actually a budget item. We're not requesting funding because I already have the money. So I would take your guidance if you think to move it forward to council to list the account, but I already received the money for the next 10 years. So that's that piece. And then Chair Ayers, and Vivian, you can introduce our guest. We do have Leah from FCA, who is the director of many services, but here specifically, she's speaking to her role in municipal agent for the elderly. And of course, I love data, so you can see how taxpayers' dollars are being used. So she would like to share a little bit about what they've been doing since they have become the new municipal agent for the elderly. So Anna Vivian, you can welcome our guest tonight.
Lamont, I don't think I could do a better job than the one you just did, but we have Lehia here, who's a great partner, and they've been so responsive to everything that we've requested. And she has prepared a couple of data points to talk about the great work that her and her team has done to help support our seniors in the Norwalk community. Lehia, take it away.
Yeah, good evening, everybody. And I know the meeting is long, so I'm gonna be brief. Family and Children's Agency have been the municipal agent for the city of Norwalk for the last 2 years, and we have served over 1,000 seniors. Why these services are important, right? It's the most vulnerable population in our city. And I'm gonna tell you a quick story, a story that we had. We had a senior that called our number, hang up. And then we called him back and he says, I'm hopeless, you cannot help me. We have happened to have him in the system because we are helping with rent rebate the year before. And then we say, we can come out and see what's happening to him. One of the social workers went out, tried to help him out, and to see he had bottles of alcohol everywhere. He has lost his social security number, all his benefits. And he says, you cannot help me, I'm hopeless. We try again. And then we have been able, the last 6 months, we've been working with him, trying to retain the social security. Now he has SNAP. He lost his wife, and his wife used to do all the paperwork. So he just got depressed, started drinking, and lost, hope in his life. And that's the reason why these programs, having somebody that they can trust, that they can go to, is so important. So most of our services are rent rebate, SNAP services, energy assistance. But with that, we have an entry point to this seniors' home. And we can identify so much more needs. So in 2023, we served 807 people just doing rent rebate. Out of those, we also had done 1,117 well-being checks. That means when a senior calls us and they want to make sure that they are okay, we go out and do assessments and check to see what their needs are. And we also done energy assistance. We do outreach to the community as well. We provide services for seniors. I invited Anna Vivian to come into our holiday party. We had about 50 seniors that they didn't have a place to go. So we came together, had a holiday party for them. And they were really happy. Some of them saying, that's the only holiday party I have. So reasons why we have to have somebody, and FCA, was contracted by the city of Norwalk to be and we are very happy. We have a home care program. So now just serving seniors is like a one stop for the seniors. If they have a need, they were talking about the testing for COVID. We distributed all the testing for COVID for the seniors that they have a need. And we have, every day somebody's at the door at 8:30 in the morning waiting for us to just provide services for them. So I hope that's helpful.
Thank you very much. So this is an example in terms of our delivery model. We subcontract on behalf of the city. They serve our seniors. And one of the things he talked about that I've learned, our senior tax rebate program is so popular. So they really take on that responsibility on behalf of the city and make sure that those seniors who are eligible and qualified for many of our municipal tax credit programs, we make sure FCA has the tools and resources and serves our senior well. Thank you so much, Anna Vivian, and thank you so much, Leah.
You're welcome.
Madam Chair, back to you.
Thank you, Chief Daniels. Councilperson Burnett.
Thank you, Madam Chair. My question is directed to Chief Daniels. Related to the comment that you made, is a dollar amount associated with this authorization?
Not this one, because the budget doesn't start till, well, yes, it does. So it is a part I don't fully understand. So we haven't approved the budget for July 1, but the contract is due now. So it's going to be, is it like 160 plus the COLA? Something like that? So we won't have the final budget until you all approve it.
So if I understand correctly, you're asking us to approve a 3-year contract. There is a dollar amount associated with the contract, and I'm assuming you're building into your current budget requests for the first year, which covers July 1, 2024 through June of 2025. But beyond that, when we start looking at year 2 and year 3, those budgets haven't been submitted. We haven't approved that. So
let me say it a little bit different. I think it's more about the reappointment, because they have to be appointed as a municipal agent.
Right. My question is there a dollar amount, any financial commitment associated with this authorization to reappoint them for a 3-year period of time?
Yes. So it's 160, but we will be every year asking for a COLA, similar how we do Norwalk Senior Center. So I don't do an annual contract with Norwalk Senior Center. The budget process has the COLA, if that makes sense.
Yes, it does make sense. I guess I'm, for the council to approve the reappointment at the same time, we're approving specific dollar amount to make this happen.
So what do you recommend? And that's what I'm asking.
I would recommend that we include the dollar amount that you're asking the council to approve as it relates to this reappointment.
So would I do all three?
So
Because I'm trying to get a way of coming to you every year because they're a line item, so they'll get a COLA. So I don't know. Maybe you're a little attorney. So I just don't know the process.
How did you address the situation with the senior center?
well,
We
the
do-
senior center doesn't need to be appointed, so I think it's the duplicative process of this contract. If you wanted to associate an amount to it, the piece that gets a little difficult is the COLA increases. We'd have to project them out and then give a lump sum amount, I guess is the way that we would need to do it. Right now for the upcoming year, it's 160 to include the COLA increase. But this is in order to reappoint them as the municipal agent for the elderly.
I guess my recommendation might be to possibly have a discussion with legal. I don't know if you've done that.
No, I
see,
did it and I can.
to see if we can approve a 3-year contract that has a dollar amount associated with it. Because that's what the council is actually not only approving them to be the agent, the vendor, also a dollar amount associated for 3 years out.
Chief, may I ask a question? Is this approval time sensitive?
Well, yes, from a procurement process, we got the email from our system to say this contract is due, which is why it's being presented before you.
Is it
But I guess we can, or I can work with the language. Can we do the reappointment just so they can maintain the municipal agent status? And then maybe do a separate.
And I'm not the lawyer on the lawyer.
So would we be comfortable, and sorry, Lamont,
No, go for it.
would you be comfortable approving that this contract for the 3-year period not exceed $510,000? And so that's 160 and projecting out a 0.05 COLA increase each year. Well, 5% COLA increase each year, which we don't think we would exceed that amount. So if we cap it at 110,000, you know that this 3-year contract period won't exceed that amount.
Yeah.
So what?
Because the ideas around, and I'll be quite frank with you all, some things just trying to avoid coming before you every single year where they're going to be the municipal agent basically until we decide they're not. I mean, the last municipal agent served for us for 15 years until they closed down and dissolved. So it's just really trying to avoid, every year have to go through this process and bring FCA through the process. Otherwise, we would determine, they're not fit or didn't meet our expectations. So if you all can help me get there, I greatly appreciate some ideas. And I definitely will bring it before legal, but I didn't.
I heard you, and what I was trying to offer up was a friendly amendment, but everybody kind of cut me off, but that's okay.
Sorry about that, Chair. That's right.
It's okay. Is it possible for the language to be twerked or altered to say that this is just the appointment of the agency and agency for this contract, and then you come back to us when you have the concrete numbers and we approve the authorization of the money? Because you can do two different steps. You can approve the contract and then the authorization later. It's just the verbiage you're using. That's number one. Number two, can we possibly table this? If it's not that time sensitive, can we table this and bring it back up at a later date? That was my 2 points.
Okay,
Yes.
piggybacking on that. I mean, I'm noticing it's July 1, 2024 to June 30th, and here we are in January. So
yeah, they've been asking us to really be a little ahead of the game instead of doing it at the last minute because, legal gets inundated at the time. So again, I got an email saying you need to move forward on this.
So is it?
But I'm open to what you're suggesting is.
But is it okay? I'm asking you, is it okay for us to split it in two or not? That was my first question.
I like that. So we could reappoint them and then.
Because reappointing them doesn't mean we're releasing any money. Because that's a whole nother process, because the releasing of any budget has to go through finance. That doesn't sit in this my understanding. It doesn't.
No, because I already have the money. They're a line item.
So if they're a line item, but still it has to go through purchasing or what, somebody else has to see it before the money physically leaves us and goes to someone else. Greg, Barbara, were you finished? Did I cut you off?
No, I'm finished, sorry.
Okay. Yeah, yes, Greg.
Thank you, Madam Chair. I would strongly recommend that we table this item until we can have the discussion with legal to ensure that, I understand that it's a convenience to extend the contract for 3 years. However, because there is a dollar amount associated with it, and because of our process of approving dollars associated with contracts, it may not be that simple to just say, let's approve it for 3 years.
Well, I agree. Let me talk with legal, and then I'll come back with a approved way of presenting this.
So as it relates to what is before us, I would like to motion, which is not debatable, to table this item until the next community services meeting.
Can I ask one question first, please? Lamont, you said
Councilperson Wiggins, there's a motion on the floor. So standard practice is we have to deal with the motion on the floor before we can continue with any discussion.
I raised my hand before the motion.
But I made the motion to table, which is not debatable. So we have to address the motion that's on the floor.
Excuse me. I got this. I got it. What we're going to do is we're going to address the motion on the floor because that is the proper way to do it based on the rules that we use to govern ourselves. Even if your hand was raised, once somebody makes that motion, we have to address it.
Go ahead, Nikki, I hear you. I got it.
It's a learning thing for everybody. You're not the only new person. Other people might have had that same question. So we're just going to address it. There was a motion made. I would say second, but I don't think I need a second. Do I need a second? No, I do not need a second. Well, we do need to call for the vote. All in favor of tabling this item until the staff can speak with legal and come back with us, can you show by raising your hands? Okay, that is unanimous. So Chief Daniels, we will wait for you to bring that back to us and we will put it down as tabled.
You got it. Thank you.
We're moving on to the next item, which is C. Authorize the mayor, Harry W. Railing, to execute any and all agreements, documents, instruments, and amendments as may be necessary with the local prevention council in the amount of $20,000 to the fiduciary Positive Directions, 90 Post Road West, Westport, Connecticut, 06880, care of the Norwalk Partnership. Chief Daniels.
Yes, thank you. So this is, and we could speak to it more, but this was what was known as the Local Prevention Council, which is now a combined group of various substance abuse, and we can speak to that. The city has made a financial commitment for more than a decade. We did not make these commitments during ARPA because we used ARPA dollars. So as pointed out, we no longer have ARPA dollars. So we are now using our operation dollars to support the local prevention council. This is in line with other municipalities. They make a financial contribution to the local prevention council. I asked Anna Vivian to kind of share the purpose, the intent, and the why of the local prevention council. But here in Norwalk, it's called the Norwalk Partnership.
Absolutely. Thank you, Lamont. So the local prevention council, you do have the one pager that goes into more detail, but the obligation is to have stakeholders from different divisions, including police, municipalities, health departments, residents, schools, and they have representatives from all these different stakeholders, including youth and residents. And what they do is try to create strategies that are Norwalk specific to prevent misuse of substance abuse, the misuse of substances. And to Lamont's point, we used to make an ongoing commitment that was around the $18,000 a year. We used ARPA funds for the last 2 years. And so what we're really seeking is to reactivate that commitment at the $20,000 mark so that they can continue the work. In your one pager, you'll see highlights of a couple of the things that this prevention council does, including the youth survey that you have all seen the data on, and that's used in order to influence what kind of trainings, what groups need to be highlighted, who are the at-risk youth, and what interventions we can partner with nonprofits to provide in the school system and in the community as a whole. It also helps support staff time in order to do all of the coordination of this, and the trainings, because the trainings are provided at a no cost to community groups. And so it's a very small commitment in comparison to the return on the investment that the city of Norwalk gets. And so I would just hope that you see the value in this, and that through your interactions with the different things that this committee has done, you've seen the value of it. Because I just highlighted a couple of the things, but teen nights out, liquor stickers, QPR training, all of these things go under the prevention scope in an effort to really try to impact the misuse of substances by our youth and our Norwalk residents.
Thank you. Councilperson Wiggins?
Greg, I'm good to speak, Greg? I'm good?
Councilperson Wiggins, you please use your time wisely and speak.
Listen, don't talk to me like that, please.
Councilperson Wiggins,
Ask a
please,
question.
late. We would like
All
to
right.
get the item.
Yeah, I asked a question. Don't talk to me like that though, please. So, I have a question. So I love Margaret, and I love, obviously the things that Norwalk Partnership does. But if I'm not mistaken, Lamont, they're in Westport, right? The organization, you're on speaker.
You're on mute.
You're on mute, I'm at.
Yes, but I just want to, if I could just speak, I think they are the fiduciary. It used to be Human Services Council, but for some reason, the positive direction is the fiduciary that holds the money on behalf of the local prevention council.
And Lamont, I can probably speak on
Thank
this
you.
a little bit. So the local prevention council is not dictated by the city of Norwalk, the identified agency. DEMIS is actually the one that identifies it, and they work with the hub. And so the hub says the Norwalk Partnership is our local prevention council for Norwalk, and that's designated through Positive Directions. So if it was a different agency, so historically, when it used to be Human Services Council, the money would go to them. In this case, in this year, Positive Directions is the local prevention identified agent, and so that's why the money would be directed towards them.
But their responsibility is to serve Norwalk residents.
Absolutely, 100%.
So the funds out of the 20,000, none of those funds is going towards like any. Huh?
No, it wouldn't be going towards any other town, only Norwalk.
Yeah. No, I mean, I'm talking about even for like, if it's like, I don't know, obviously I don't know their budget, but there's no operating funds going towards, anybody that's Westport, only because, if it's funds, if we're approving it for Norwalk, I think not even a dime should be going to anyone from Westport. That makes any sense.
So Lamont, I can speak on that a little bit. One of the pieces that it isn't on the sheet, but that I can speak to is that Positive Direction does a lot of fundraising for the work that they do in Norwalk. The work that they do in Norwalk far exceeds the 20,000 that we're putting on the table right now. So they receive both the LPC and the COR grants from DEMIS, and it's about 14,000. And then they also applied for a larger grant, a planning grant, and that's a little over 100,000. So in that scope, we're talking that they're independently applying and fundraising $120,000 to serve Norwalk residents, to do the survey for staff time, materials, and all of the outreach that they do, and to provide those trainings. So we're putting in a little bit to what they're already braiding and contributing to the community.
I'll acknowledge you 1 minute, Councilperson Burnett. Anna Vivian or Chief Daniels, can you just reiterate? I think I heard you correctly, but just to reiterate. So positive directions, Norwalk is part of their catchment area. That's all I needed to know. Councilman Burnett, please.
Thank you, Madam Chair. I guess my question is directed to Chief Daniels.
No.
Yeah, it is. Again, I mean, the 20,000, where's the $20,000 coming from?
It's in my operational budget. So again, I'm always figuring out how much to give you. So I have a line item in my budget that was designated for this.
So you've answered my question. So
Okay.
you have a line item to cover the $20,000. That account number line item is not listed here.
Okay, I forgot to ask Jasmine to put it there.
We
Right, because
should-
sometimes people say put it, sometimes people say don't.
we should just know where the money is coming from in the
Yes.
budget.
So this is not an outside request. It's already in the community services budget.
Right. We just need to know what that line item account number is.
Got it.
Can you do me a favor? When you update it before we send it to the full council, can you make sure that information is added to the?
Noted.
Any other outstanding questions? Hearing and seeing none, all in favor, please raise your hand.
Madam Chair, we didn't move the item first.
Move the item.
No, but I'll move it.
I said it was, but this is why I said it was late.
I'll
Thank you.
move it. So
Burnett.
now,
I do it, Nikki, I do that all the time. I forget. And we're lucky we have Greg here because Greg's our process.
Greg,
man.
I'll make
Always
sure.
catches us.
Look, until
All
he's
good, all good, all good.
Okay.
fine. Councilperson Burnett. Let's do the vote one more time. All in favor, raise your hand, please. It looks unanimous to me, so that passes. Thank you. Our next part is my most favorite part, number 6. It is adjournment. We thank Chief Daniels and his team for being with us.
Thank you all for your time.
Hope you all have a wonderful night. Thank you. Good night, everyone.
Thank you so much. Have a good evening.
Good night.
And then I can go home.